My friend has been diagnosed with type 1 diabetes. What is it? How will the doctor treat him?
Type 1 diabetes is a patient who completely lacks insulin. For this patient, insulin replacement is the only way of treatment. Now, how do we replace insulin is the whole question mark. Either we use short-acting insulins, we use long-acting insulins, or we use long-acting insulin analogs. Now, we either give them injectable insulin using the syringe and bottle. Nowadays, we have pens available. We have all insulins available in pre-filled as well as disposable pens. The needles are very fine. Some of the pens have also an electronic system which calculates the amount of dose, and you can give insulin to patients with type 1 diabetes to as low as 0.5 units also. These are the insulin pens which have been in the market for more than a decade. Apart from the insulin pens, the most recent advancement in technology is the insulin pump and what we call as the CGM. CGM is a continuous glucose monitoring system. It's a small sensor which is placed on the outside of the patient, and it senses blood glucose for every 5 minutes for the next 7 days. And this sensor gives us a complete idea of how the blood sugars of the patient will be fluctuating. Most patients with type 1 have a fluctuant blood sugar like the Sensex in the National Stock Exchange, and keeps on fluctuating, and we need to find out how the fluctuations are, what we call as glycemic variability, and treat them. So CGMS, that is the continuous glucose monitoring system, is an advancement in the treatment of diabetes, and followed by what we call as an insulin pump. An insulin pump is very close to what we call as an artificial pancreas. The insulin pump is externally fitted with a cannula which goes into the subcutaneous tissue on the abdomen. The insulin is delivered through a cannula. Because type 1 diabetics require multiple shots of insulin, these can be the number of shots he needs to take with an insulin injection is given away, and the insulin pump is an easy replacement of giving insulin through the cannula. There is a reservoir in which insulin is kept, and as and when the demands of the patient, the insulin pump, you just have to press a button and insulin goes in. So instead of pricking the patient, one can use as many doses of insulin, could be 5, 6, 10 doses of insulin without pricking, and that helps in better control, and that helps in better quality of life and better flexibility in patients with type 1 diabetes. Now we also have what is called as a sensor augmented insulin pump. Sensor augmented insulin pump is where the sensor is the CGM, that is the continuous glucose monitoring system, is inbuilt with the insulin pump. So the sensor will kind of detect the sugar, and the insulin pump will then one will have to calculate how much dose is to be given, but there are various calculation parameters on which one can decide that how high is your sugar and how much is the dose to be given, and one can give the dose accordingly. These are called sensor augmented pump. The latest advancement in the insulin pump is called as a low sugar suspend insulin pump, which is again a sensor augmented pump, and as soon as the sugar goes down, the insulin pump gets suspended. That means it automatically stops and doesn't give insulin and prevents hypoglycemia, and also gives an alarm and beep to the patient and relative to realize that the patient's sugar is dropping. So these are the various advances in the management of type 1 diabetes, and we are not far from actually having a closed loop where the sensor will kind of pick up the glucose, would give the signal to the insulin pump. The insulin pump would analyze on its own and how much insulin to be given, and would give it on its own without actually the patient putting in his mind in it. That would be in the near future, and that would actually be an artificial pancreas.